Case study analysis, interpretation, presentation. Natalie Perez, Biostatistics. Based on a description of the data, a large percentage of the men, 73.34%, have diagnosed hypertension, while only a small percentage, 3.25%, use antihypertensive medication. Very few, 9.36%, have had a stroke. Almost half, 49.19%, of the males are currently smokers. The average serum cholesterol of 236.98 is considered high. More women participated in the study and had a slightly higher average age than the men. Women had overall higher average systolic blood pressure than the men, with 133.84 compared to 131.74. Average cholesterol levels were also higher for women at 239.68 milligrams than men at 233.58 milligrams. The average glucose levels of the men and women were almost equivalent, with women averaging 82.07 and 82.32 for men. The men had a higher percentage who smoked by a considerable percentage, 60% versus 20%. The use of blood pressure medication among the women was twice as high at 4.1% than the men at 2.16%. The percentage of women diagnosed with a stroke, 8.92%, was lower than the men with 9.93%. The crude and multivariable effects were quite different. The differences can be accounted for because multiple factors can impact glucose levels. It is unlikely that each characteristic will exist on its own in a single participant. The characteristics that changed the least was being male, but the p-value for both was greater than 0.05, so it is not considered statistically significant. Having diabetes has a significant impact on glucose levels in both the crude and multivariable models. In the multivariable analysis, the p-values for cholesterol and current smoker were greater than 0.05, making them also not statistically significant. All the regression coefficients in both models are positive values, meaning there is a positive correlation between the characteristic and a rise in glucose levels. Patients with no history of coronary heart disease showed lower levels in all of the tested risk factor characteristics. The standard deviations for all values were lower for those with no history of coronary heart disease than those with a history of coronary heart disease. All the characteristics had a p-value less than 0.05, making them statistically significant. The systolic blood pressure of those with no history of coronary heart disease of 132.35 was considerably lower than the systolic blood pressure of those with a history of coronary heart disease at 145. Both groups had an average cholesterol in the high range, above 200 milligrams, and both had average BMIs in the obese range. Data from this heart study was collected using health history, questionnaires, physical exam, and autopsies. It has been collected for over 3 generations of participants. This particular study included only the data from the first observation. Glucose data was analyzed using regression models. Coronary heart disease data was analyzed using t-tests to compare means. A Cochrane-Mantell-Hansel method of analysis could have been used to generate an estimate of association between a risk factor and coronary heart disease.